Welcome to Science Force, where science comes alive.
Hello everyone and a very warm welcome. I'm absolutely thrilled to have you join me today. We are going to unpack a topic that affects millions across the globe, yet is so often totally misunderstood. We're decoding diabetes mellitus, exploring what is essentially the body's ultimate energy crisis. Whether you're a curious learner just wanting to understand your own health or a dedicated life science or medical student looking for clinical precision, you are in exactly the right place. We're going to bridge everyday analogies with exact clinical science, making the complex beautifully simple. Okay, let's dive right in. Here's our roadmap for today. We'll look at the normal energy system, what happens when that system fails, the warning signs to look out for, how we diagnose the danger, the long-term fallout, and finally, management and prevention. Let's get started. Section 1. The body's energy system. Before we can truly understand this disease, we've got to appreciate the beautifully balanced factory that is a healthy human body. So what exactly is diabetes mellitus? It's a chronic metabolic disease where blood glucose or blood sugar stays persistently high. For the life science students tuning in, the history here is actually fascinating. Diabetes comes from a Greek word meaning to pass through, which refers to excessive urination. And mellitus, that's Latin for honey sweet. Put them together and it describes the sweet taste of urine caused by all that excess unused sugar. Believe it or not, historically that's exactly how ancient physicians diagnosed it. Crazy, right? So let's look at how things are supposed to work, the normal pathway. When you eat carbohydrates, your body digests them straight into glucose, which then enters your bloodstream. The moment that happens, your pancreas, specifically these brilliant little beta cells inside the islets of Langerhans, springs into action. They produce a hormone called insulin. Now, I want you to picture insulin as a master key. This insulin key perfectly fits the locks on your body's cells. It turns, opens the doors, and lets the glucose rush in. Once inside, your cells use that glucose to produce the energy that literally powers everything you do. It's an incredibly elegant, highly efficient system. Okay, let's dive right in. Here's our section 2, when the system fails. But what happens when this perfectly balanced factory breaks down? Your cells are literally starving, even though they're swimming in fuel. Let's contrast the two main types of this breakdown. On the left, we've got type 1 diabetes. This is an autoimmune condition where the body's own immune system accidentally attacks those beta cells in the pancreas. The factory just completely stops making insulin. The key is completely missing. This usually shows up in kids and young adults and requires lifelong insulin injections. Now on the right, we have type 2 diabetes, which is by far the most common form. Here your body is still producing insulin, but the cells, they've become resistant. The key is there, but the lock is rusty. It just doesn't turn. Eventually, the poor pancreas gets completely exhausted trying to force that door open, and insulin production drops. And this one is heavily driven by lifestyle factors, things like obesity, lack of physical activity, and unhealthy diets. Now, beyond the classic type 1 and type 2, there are a few other specific types we definitely need to acknowledge. A crucial one is gestational diabetes, which happens during pregnancy. What goes on here is that pregnancy hormones actually interfere with the mother's insulin. They temporarily hijack the whole system, causing blood sugar to spike. Now, while it usually clears up after the baby is born, it does increase the mother's future risk of developing type 2, and it can cause the baby to have an excessively high birth weight. We also occasionally see diabetes caused by specific genetic mutations, pancreatic diseases, or even as a direct side effect of certain medications. Section 3. Recognizing the warning signs. So when your cells are starving and sugar is just piling up in the blood, the body doesn't stay quiet. It starts sounding the alarm bells. Let's decode the classic symptoms known in the medical world as the 3 Ps. Polyuria. This simply means frequent urination. See, because there's so much excess glucose in the blood, it spills over into the urine, and water inevitably gets dragged right along with it. Polydipsia. This is constant, unquenchable thirst. Since you're losing so much water from the frequent urination, your body gets severely dehydrated. Polyphagia, meaning excessive hunger. Because all that glucose is locked out of the cells, your body genuinely believes it's starving, making you incredibly, constantly hungry. But the alarm bells certainly don't stop there. Since the cells are deprived of energy, patients often feel profound, crushing fatigue. You might also notice blurred vision, unexplained weight loss, frequent infections, and cuts or wounds that are painfully slow to heal. Plus, there can be this very specific tingling or numbness in the hands and feet. It's wild when you think about it. The sheer lack of usable cellular energy impacts absolutely everything, literally from your eyesight down to your immune system. Now, I want to slow down for just a second because we absolutely have to talk about a critical medical emergency, diabetic ketoacidosis, or DKA. We primarily see this in type 1 diabetes. When the body can't use glucose at all, it totally panics. To survive, it starts rapidly burning fat for fuel. But this rapid fat breakdown produces these highly acidic substances called ketones. Symptoms include severe nausea, vomiting, confusion, and deep, rapid breathing. And for the medical students watching, pay close attention here. A vital diagnostic clue in the ER is a distinct fruity-smelling breath. Without immediate medical treatment, DKA can be completely fatal. Section 4. Diagnosis. So that brings us to a massive question. Apart from the severe physical symptoms, blood sugar often just creeps up quietly over time. How do we actually catch this silent sugar buildup in the bloodstream before it causes irreversible damage? Let's shift gears, head into the clinical lab, and open up the doctor's diagnostic toolkit. First, we have the fasting blood glucose test, which checks your baseline sugar after an 8 to 12-hour fast. Then, there's the oral glucose tolerance test, or OGTT. This measures how well your body handles a super sugary glucose drink over a couple of hours. We also have a random blood glucose test that can be done anytime. But I really want you to focus on the HbA1c test. This one is like the ultimate 3-month sugar memory test. Because glucose naturally attaches to your red blood cells, and those cells live for about 3 months, the HbA1c test gives doctors a perfectly clear average of exactly how high your blood sugar has been over the past 2 to 3 months. Basically, you cannot cheat this test. Section 5. The long-term fallout. Okay, so we know how to diagnose it. But what actually happens if this excess sugar is just ignored and left wandering wildly in the bloodstream for years and years? We need to take a very serious look at how chronic high sugar systematically destroys blood vessels and nerves over time. Think of persistent high blood sugar almost like microscopic shards of glass flowing through your veins, slowly damaging vessels and nerves everywhere. Let's translate these clinical terms into their real-world impact. Retinopathy. That's damage to the blood vessels in your eyes, leading to blurred vision and even total blindness. Neuropathy. This is nerve damage, causing burning, numbness, and real difficulty walking. Nephropathy, which is the destruction of the kidneys, causing protein leakage and eventually complete kidney failure. Heart disease. There is also a vastly increased risk of cardiovascular disease, meaning heart attacks and strokes. Diabetic foot. Because of poor circulation and deadened nerves, a simple scratch can go totally unnoticed. That can quickly turn into non-healing ulcers, severe infections, gangrene, and tragically, amputations. The gravity of untreated diabetes truly affects the entire body, from head to toe. Alright, let's bring the energy right back up. Because while diabetes can't always be completely cured, it can absolutely be controlled. There is immense hope and healing in taking charge of your own body. Here are the highly actionable steps for management and prevention. Healthy diet. We are talking vibrant, colorful vegetables, whole grains, nuts, and lean proteins, while strictly limiting sugary foods, fast foods, and soft drinks. Physical activity. This is an absolute game changer. Walking, jogging, swimming, regular exercise actually improves your insulin sensitivity. It literally helps scrub the rust off that lock. Medical interventions, things like insulin therapy, which is absolutely essential for type 1 and advanced type 2, along with oral anti-diabetic drugs that lower blood sugar and stimulate the pancreas. Monitoring, regular monitoring using glucometers or continuous glucose monitors. By just maintaining a healthy weight and staying active, a massive portion of type 2 diabetes can be completely, 100% prevented. Conclusion. We've journeyed all the way from the cellular mechanics of insulin right through to the systemic impacts on our organs and finally to the incredible power of lifestyle medicine. But I want to leave you
with one final thought to ponder today. As our modern world becomes increasingly sedentary and highly processed foods become the norm, we really have to ask ourselves, are our daily choices actively feeding a global biological energy crisis?
Thank you for watching Science Force.